Alright, welcome back to people. This begins another week of my videos that I create every week for you. That's right, you watching this video. I do this for you. What do you mean, no I don't? You're probably right, but I do it for us. How about that? Anyway, this week, since I'm so close to the end of creating this 200 videos and 365-day process, actually I have like 15 left. Can you believe that? Starting in January, this is September, and I've got maybe, actually this is number 181. So I've got 20 left, but after this series I'll have only 15 left. And then I'll be able to transition into what I want to do next, which is creating an online course. Now, the online course that I'm creating is probably going to sell for around $199 or $299, somewhere in that arena. And I may keep it a little less expensive, just depends on how many modules I have. I'm thinking about 4. And since I'm new to this, I kind of like to, make it where people who are not really internet savvy can kind of follow along and kind of, get into the process or understand the process without a lot of technical understanding. Because I found that, see, my target audience are baby boomers, people who are in the process of retiring, who are thinking about retiring, who have retired, but have free time, have plenty of free time, and know that there is more left in life than just sitting around watching the idiot box, right? You can do something to generate money, something based on what you like. And today, in the 21st century, we're in what's called the information age. Now, that's not too far-fetched from the technological age, right? Because you combine those two and you can make a lot of money. You can make a really good living. And basically from home, And that's the beauty of it. You don't have to go to a lot of different events. You don't have to constantly be on the road. No, if you choose to, you have that option. But it's not necessary. You can make all the money you want from your one location, home, right? You can have an online business from home that generates enough money that probably surpasses what you made while you were working for a living. Because at your point right now, you're really not focused too much on money if you're retired, right? Or if you're planning to retire, you pretty much have your ducks in a row if you're smart, right? So what your issue is going to be, what are you going to do with all that time you now have, right? Because time is, it's fleeting, and it's forever fleeting. So if you don't fill that time with something of substance, excuse me, then that's a lot of wasted time. And let's say you retire at 60 or 65 and you live to be 85. That's 20 years you did nothing. You are so much more than that, right? Don't you want to contribute more to the ecosystem or to the world that we live in? Yes, you do. You are worthy. You are valuable. You have information that people can use, especially if you had a profession before you retired, right? So just think about that. If you didn't have a profession before you retired, that's okay, because you can learn something. Wait a minute. Come back. Yes, I said learn. A lot of people I share information with, wow, they do not, with a capital N, want to learn anything. How can that be? My mind it finds it difficult to wrap around that. You want to just know what you know, and that's it. And a lot of times what you know is not even the truth. That's not even what you know. You've just been told that by somebody that you trust, and you didn't verify with any other resource, right? But anyway, I get sidetracked. So on this video, I'm going to talk about something that, oh, my nose is itching. I'm going to talk about something that maybe you are familiar with, or maybe you're not. But when I start talking about it, you will become familiar with it with yourself, and that's phobias. What are phobias? That's the first video I'm creating this week for you guys. And by the way, my blog is speakwithlarry.blog. My website is speakwithlarry.com. Get a chance, go and subscribe to those and sign up, like, how we do it here on the internet, right? Because think about this. At some point, once you decide that what it is that you want to do, you'll be saying the same thing to your clients or to your audience. Make sure you like these videos, subscribe to this channel, on and on, right? That's how the game is played. And that's what you want to get familiar with. You want to get in the game. You want to get off the sideline and get in the game. That's very important. Very, very important, because you only have one life to live. And you know, life is short, especially for people who look like us, right? So let's get into contributing, what we can contribute to this thing we call life, right? All right, phobias. What are phobias? A phobia is a type of anxiety disorder defined by a persistent and excessive fear of an object or situation. The phobia typically results in a rapid onset of fear and is present for more than 6 months. 6 months. That means you're afraid of something that you saw 5 months ago, still today, right? Not panicky, but you know, when you see one, you recognize it, right? It continues on and says, the affected person goes to great lengths to avoid the situation or object to a degree greater than the actual danger posed. If the feared object or situation cannot be avoided, the affected person experiences significant distress. Can I get a witness? Because I have that effect when I'm around snakes. And that's just my personal reaction to them. I'm not saying that you shouldn't like them or anything, but I don't like them. So I don't like to be around them. And whenever they're in the neighborhood or in the vicinity, my eyes are on them, right? Because I don't want no accidents. All right, continuing on. With blood or injury phobia, fainting may occur. Agoraphobia is often associated with panic attacks. Usually a person has phobias to a number of objects or situations. Phobias can be divided into specific phobias, social phobias, and agoraphobia. Types of specific phobias include those of certain animals, natural environment situations, blood or injury, and specific situations. The most common are fear of spiders, fear of snakes, fear of heights, all three. Occasionally, they are triggered by a negative experience with the object or situation. Social phobia is when a situation is feared as social phobia is when the situation is feared as the person is worried about others judging them. Agoraphobia is when fear of a situation occurs because it is felt that escape would not be possible. Ever been there? Right. Those phobias are real. I mean, you know, you can we can think ourselves afraid, right? So if you actually are afraid of something in your mind, like me, of snakes, and you put me in a room where it could be ropes, but you're telling me that it's snakes, my mind is thinking snakes, right? That's how that has an effect on you. It says, it is recommended that specific phobias are treated with exposed therapy where the person is introduced to the situation or object in question until the fear resolves. Medications are not useful in this type of phobia. Social phobias and agoraphobia are often treated with some combination of counseling and medication. Medications used include antidepressants, benzodiazepines, and beta blockers. Most phobias are classified into 3 categories. Specific phobias, fear of particular objects or social situations that immediately result in anxiety and can sometimes lead to panic attacks. Specific phobias may be further subdivided into 5 categories: animal type, natural environment type, situational type, blood injection injury type, and others. Agoraphobia, a generalized fear of leaving home or a small, familiar, safe area, and of possible panic attacks that might follow. It may also be caused by various specific phobias, such as fear of open spaces, social embarrassment, fear of contamination, fear of germs, possibly complicated by obsessive-compulsive disorder or PTSD, post-traumatic stress disorder related to a trauma that occurred out of doors. Social phobia, also known as social anxiety disorder, is when the situation is feared as the person is worried about others judging them. Vicarious fear acquisition is learning to fear something not by subject's own experience of fear, but by watching others' reaction fearfully. Observational learning. For instance, when a child sees a parent reacting fearfully to an animal, the child becomes afraid of the animal as well. Now, informational or institutional fear is learning to fear something by getting information. For instance, fearing electrical wire and having heard that touching it causes an electrical shock. And a conditioned fear response to an object or situation is not always a phobia. To meet the criteria for a phobia, there must also be symptoms of impairment and avoidance. Impairment is defined by being unable to complete routine tasks, whether occupational, academic, or social. Now, that was some good information about phobias. If you hadn't been informed about phobias, some of those I didn't know. Some of those really hit the nail on the head, because we are all different and we all react differently to different things. But whatever you're afraid of or whatever you have a fear of is real to you, right? It's real. It's absolutely real. It shouldn't be played with, because it can shift. And today we have a lot of mentally disturbed situations and people, right? So you don't know what a person has gone through and what a person is going through. So you have to be kind of cautious when you introduce somebody to like a snake or maybe a spider, because hey, you never know what the consequences are going to be, right? But there are going to be consequences. If there's enough fear, there's going to be some furniture moving, right, to get away. All right. Again, like these videos, share these videos, and I'll see you on the next video.